So in this video, we will talk about Fingolimod or Gilenya, which is the first oral medication approved for the treatment of multiple sclerosis. Gilenya, as I mentioned before, is an oral therapy, once-a-day medication that is intended to help us slow down the progression of multiple sclerosis. The mechanism of action is by working with your immune system. Literally will trap the immune cells inside the lymph nodes, and those are the immune cells that are responsible for causing damage and pathology in MS. One of the consequences of that is that patients will have less available cells, immune cells that may help to fight infections and other problems. So common complications of Gilenya include infections, but also because the drug works in a receptor that is also present in other cells, it's been known to cause cardiac side effects, in particularly AB block or decreased heart rate in patients taking the medication. For that, any patients that are considering this medication should review very carefully the history of prior disorders, including strokes or heart blocks or heart attacks, which may be contraindicated for the use of this medication. We often have to monitor before even considering this medication as certain risk factors, including doing an EKG, doing a blood pressure monitor, and some lab work. After the patient has discussed with the provider that this is the right medication for them, we have to schedule the first dose administration. And what that entails is a 6-hour monitoring and surveillance for potential complications, doing blood work and vitals, as well as an EKG. After patients complete the 6 hours monitoring, if there are no concerns or any side effects, patients may be discharged home with 2 weeks worth of medication to start taking once a day. So for that, it's very important that you discuss potential risks, benefits with this medication with your healthcare provider before making a decision. It's also important to note that this medication should not be used in females who are planning pregnancies or who are pregnant. If patients require the administration of live virus vaccines, the medication has to be stopped for at least 2 weeks. And before resuming the medication, we have to often start the first dose administration again, particularly if patients stop the medication for more than 4 weeks. In order to mitigate potential side effects, it's also important to discuss with your healthcare providers that any medication you start after you've been on Gilenya has to be discussed with your doctor. Your doctor may also choose to do frequent lab work, including lymphocyte count and other tests, in order to understand the potential risks or side effects of this medication. In addition, if you have diabetes or asthma, or if you're a smoker, you should discuss this with your doctor, as this could have potential serious side effects as well. Lastly, in terms of infections, it's been recently reported few cases of PML, or progressive multifocal leukoencephalopathy, in patients receiving Gilenya or Fingolimod.